This is scapular elevation for upper trapezius and levator scap manual muscle testing. Patient position is seated with the arms at the sides, no back support, and hands not in contact with supporting surfaces. Palpate the upper trapezius near its insertion on the clavicle. No stabilization is necessary during this test. Turn the patient's head away from the side to be tested. Elevate the patient's acromion towards the occiput as far as possible and abduct the patient's shoulder on the tested side to 90 degrees. Palpate the upper trap and instruct the patient to do the same motion. Apply resistance to the proximal elbow in the direction of shoulder adduction and over the posterior aspect of the occiput in the direction of anterior and contralateral neck flexion. There is no gravity eliminated position for this test. This is scapular adduction for the middle trapezius manual muscle testing. Patient position is prone with the shoulder in 90 degrees abduction, full lateral rotation, and 90 degrees elbow flexion with the patient's head turned to the contralateral side. Palpate the middle trapezius between the vertebral border of the scapula and the spinous process of lower cervical and upper thoracic vertebra on the same side. Stabilize with one hand over opposite thorax to prevent trunk rotation. Move the patient's scapula through full range of adduction while keeping the upper extremity positioned the same as before. Instruct the patient to go through the same motion while palpating and stabilizing. Apply resistance over the lateral aspect of the scapula in the direction of scapular abduction. For the gravity-eliminated position for scapular adduction for grades below 3, patient position is seated with the shoulder abducted to 90 degrees and in full lateral rotation with the elbow slightly flexed. Palpate the middle traps between the vertebral border of the scapula and the spinous processes of lower cervical and upper thoracic vertebra on the same side. Move the patient's scapula through full range of adduction while the upper extremity slides along the table. Stabilize the superior aspect of the opposite shoulder and palpate while asking the patient to perform the same motion, sliding the upper extremity along the table. This is scapular adduction and depression for manual muscle testing of the lower trapezius. Patient position is in prone with the shoulder at about 130 degrees abduction and 0 degrees elbow extension with the patient's head turned to the opposite side. Palpate the lower trap between the root of the scapular spine and the spinous processes of lower thoracic vertebra, and then stabilize with one hand over the posterior aspect of the opposite thorax. Bring the patient's scapula through full range of adduction and depression by elevating the arm off the table. Palpate and have the patient repeat the action while stabilizing. Apply resistance in the direction of scapular abduction and elevation. There's no separate position for testing this muscle for grades below 3 in gravity eliminated position. This is scapular adduction and downward rotation manual muscle testing for the rhomboid major and minor. Patient position is prone with the shoulder in 0 degrees adduction, full elbow flexion, and full forearm pronation with the dorsum of the hand on the back. Patient's head is turned to the contralateral side. There's no stabilization necessary for this manual muscle test. Palpation is of the rhomboids on the same side as the test arm between the vertebral border of the scapula and spinous processes of C7 through T5. Move the patient's scapula through full range of adduction and downward rotation while keeping the elbow flexed and forearm pronated. Palpate and ask the patient to do the same position. Apply resistance on the vertebral border of the scapula in the direction of scapular abduction and upward rotation. This is the gravity-eliminated position for scapular adduction and downward rotation. Patient is seated with the arm to be tested behind the back, shoulder medially rotated and adducted so that the dorsum of the hand is in contact with the glute on the same side. Palpation is on the rhomboids between the vertebral border of the scapula and spinous processes of C7 to T5, and stabilization is on the shoulder girdle Move the patient's scapula through the full range of adduction and downward rotation while raising the dorsum of the patient's hand away from the back. Instruct the patient to perform the same motion while stabilizing and palpating.